intrigued me about Bill Rossi was he started out in his parents' shoe store, fitting footwear. And so even before he became a podiatrist, he started seeing the relationships people have with their shoes and learned a little bit about fitting and so forth. Then he went on to podiatry school. And when he got done with podiatry, he actually traveled throughout the world, and what's so fascinating about his writing is it's rich with photographs. But I think what's different about Dr. Rossi's work is he has another layer of wisdom based on his worldwide experiences that the average podiatrist doesn't have. So the average podiatrist, I don't think, conceptualizes that it's possible to maintain that natural healthy baby foot shape into adulthood. But when you read Born to Run and you travel into some of these places and you look at these 5th and 6th decade feet, they're still widest at the ends of the toes. Another piece I should share with you is I went to Africa personally in 1984. And I had several observations. This is pre-podiatry, but I remember thinking two things. They were sprinting across gravel playing soccer, barefoot, sprinting. And I remember thinking to myself, I couldn't walk across that, much less run. And the other flip side of that was they wanted my shoes, and I remember thinking, wow, if you can do that with your foot, why do you want my shoe, So I had a couple of early experiences too that helped me to understand and appreciate Dr. Rossi's work, which was worked in a shoe store, got the podiatry degree, went around the world, and I guess the fourth layer to that is that he consulted with numerous shoe industry people for probably 20 or 30 years. 15 years down the road after reading his work, which basically encouraged me to look closer at footwear. I'm trained to look at your foot type. Are you a pronator? Are you a supinator? Do you have a forefoot varus, forefoot valgus? And try to classify your foot in comparison to the general public and then come up with a treatment that is appropriate for that foot type. I no longer believe that that's a very scientific method. Much of that methodology is achieved from non-weight-bearing examinations of people. But the point is, in 1999, I read Dr. William Rossi's article, Why Shoes Make Normal Gait Impossible. And this is in Podiatry Management magazine. And I went home and I read that, and I remember saying to my wife, the way this doctor writes about the work that we should be doing has me thinking that maybe I'm not doing the best work I could be doing for people. One of the gentlemen I saw, first patient I saw this morning, had been told by the doctor his time of running is done. Well, he's going to do a Boston qualifier in 10 days, at the Eugene Marathon. So there's a lot of people out there that just aren't getting the right messages. They're getting, in my opinion, unscientific, outdated, well-intentioned opinions about what we should have on our feet, how we should run, and so forth. At that time, I also started spending time with physical therapy community who took a more subtle, slower, manual approach to things, and I started the process of using silicone spacers between my big toe and second toe. I started telling my patients with the same problems that I had that maybe we don't want to go to the hospital and do a bunionectomy and a hammer toe correction. Maybe we want to do some rehab, spread your toes out, get a better shaped footwear, and give it time. And that's been the remarkable thing, is that this works for everybody, but it's very slow. It's a very gratifying, natural approach, but it's not like surgery. It doesn't happen overnight. It's more likely to be a year or a couple of years down the road. But we've been practicing this way for 15 years now, and some of the testimonials that we get are nothing less than miraculous in the minds of the people that are still running and achieving their goals. And so that's a bit about me.
Yeah.